Welcome to the iPad training for the UCI Flying Samaritans. We're going to go over some basics of using the iPad. So let's go. So electronic medical records, abbreviated by EMR, that's what we're using on our iPads. It's an app, it's called Missive EMR. So we do have an opportunity for you to practice with this system before you ever even go to the clinic. So if you have an iPad that runs on iOS 7 or newer, or you'd like to check one out from the UC Irvine Library, feel free. There are instructions on this page that tell you how to download the app and then the login information that you'll need. We do have like a test zone on the app for you to use. You will not have access to our actual patient database, and that's just to protect their privacy and still give you an opportunity to learn how to work your way around the app, because it's a little bit tricky at times. Okay, so this is what the app will look like upon opening it up. So notice here at the bottom, highlighted in blue, it says UC Irvine Undergrad. Now the instructions on the previous slide directed you to click Test EMR instead. So if you're following along with an iPad and you've already downloaded the app, you'll want to click Test EMR rather than UC Irvine Undergrad. Okay, so we just want to make sure we're in the right database. You can also see that UCLA has their own database, as does UCI Medical School Flying Samaritans. They have their own database for their patients. So you'll want to enter the login information, and that information we've provided to you. This is the current login information that I'm using on the iPad that I'm showing you. And then if you look at the bottom here, circled in red, labeled number 2, that's patients. So after you've put the username, password in, tapped login, you're going to want to tap patients at the bottom. And that's going to take you to this screen here. So you notice on the left we have our patients. We blurred their names out for privacy reasons. We have our patients listed alphabetically by last name. And then you have a blank new patient intake form. So in order to search for a patient, the patients all sign up on a list. You'll want to go in descending order. So you'll tap the search bar, and then you're going to type in the name you're looking for. So in this example, I'm typing in John Doe. And you can see here I circled no results because I couldn't find him. We don't have a John Doe in our system. So you're going to go ahead and tap cancel. And what we're going to do instead is we're going to create a new patient profile. So you're going to pay close attention to this because it can be a little bit tricky, and you will at some point have to create new patient charts. So tap the plus sign that's circled up on the left hand side. It says create new patient profile, and then you can see boxed it says new patient, and so that's just to ensure that you actually are setting up a new patient profile. And then our direction number 2 here says edit new information. So once you've tapped the plus sign, then you're going to tap edit in the upper right hand corner. Okay, and then it's going to let you input the information. So I went ahead and put first name John, last name Doe, where they live. I went ahead and put John Doe's birthday, John Doe's gender. Note that you can also put guardian name, you can put occupation, phone number. The main things that we care about here are their date of birth, their gender, their first and last name. If they are a minor, then you need to put their guardian name as well. Okay, and so when you're done, in the upper right hand corner, you tap done, and you've just created a brand new patient profile, and this is what that patient's chart's going to look like. And you'll always be able to scroll through on the left and pull up John Doe. So let's pretend you're searching for a patient that actually exists in our database. So here we're searching for Jane Doe, and we found Jane Doe, and we tapped the name Jane Doe on the left, and it pulled up her information here on the right. And it shows again her gender, birthday. In this case she's a minor, so we put guardian name and then first and last name. So then we have entered Jane Doe's, or we're going to try to enter Jane Doe's chart. So up on the left hand side here where it says notes, you're going to tap notes, and then this is what you're going to see. This is essentially a blank chart note. But you can't start working in this blank chart note. It's very important that the next couple steps you follow every single time, or it will mess the charts up. So you're going to tap notes again in the upper left hand corner. This is going to give you access to all of her past notes. In the case of a new patient, they're not going to have any past notes, and that's okay. You can just tap the plus sign instead and start a new note. But anyway, we're pulling up her past chart note, so you're going to click her most recent chart note, select that, and then you can see here in the background that it pulled up like her information and such. And so then you're going to select the plus sign after you've done that, the plus sign next to notes, and it's going to pull up this field here that says past medical family, allergies, prescriptions, all that business. You're going to swipe to the right because we want to select all of these things. Basically, it's going to pull all the information that is related to allergies, prescriptions, past medical, and family history. It's going to pull all that from the chart that you were previously on, and it's going to add it to a new chart note that you're creating. And then you're going to select Fill Note. Now notice here, again, if we were starting a new patient file here and they had no notes previously, then you're just going to hit the plus sign and then you would select Blank Note, because you would start a fresh note for a fresh file. Okay, and then this is what it's going to look like now that we've properly imported her old data. So you can see under allergies, this particular example, she has a penicillin allergy, which we were able to pull from her previous chart when we started a new chart. Alright. So then to access the Spanish translations for the English-speaking triagers, you're going to swipe all the vitals to the right. So you'll go one by one, swipe O2 to the right, swipe height to the right, swipe blood glucose to the right, and it's going to show you a gray box that says Espanol. And then you're going to tap the gray box, and it's going to bring up this screen here. And the translation will be there for you to read, so you can read it yourself in Spanish, or you can hit that blue arrow, and the app will actually read it in Spanish for you. For our purposes, we're interested in learning and your personal growth, so we want you guys to read from the app and practice your Spanish speaking skills, English speakers that is. Alright, so these are all the vitals that you're going to be taking pretty much every single time you're at the clinic. Blood glucose you won't take, that's reserved for people who have been trained to do it, and for diabetes patients who agree to those labs being taken. Right eye, left eye, so that's vision. If a patient has already had that in the past, or if they don't want to have it taken again now, then they can decline that one, but the rest of it you will take every single time. So you can see here we also want you asking allergies. So in order to add allergies, you just hit the plus sign, and then you can add any drug, food, or chemical allergies. Notice on the right here the prescriptions is crossed out. You never ever touch the prescriptions box. This is for the pharmacist to touch only, and that's because we have a whole inventory that we don't want to get messed up. So just refrain from touching that part. Pharmacy handles it after you pass the chart on to them. Dental, notice here it says chief complaint right under dental, and then there's a chief complaint right under the whole dental section. So the chief complaint right under dental, that's their complaint, that the reason why they want to see the dentist, basically. Don't get that confused with the other chief complaint written below this. That's the medical chief complaint, why they want to see the doctor. So make sure you guys are writing in the correct area for each bit of information. And you see, because we were able to pull her previous information, we had her last dental visit and her previous work done put into this section already. Alright, so then here's the medical section. So once you've taken all the vitals, you are going to document chief complaint. This should really only be maybe 1 to 5 words, very brief description of why they're here. So like a stomach ache or a headache, a cold. History of present illness, notice this is a whole paragraph, and we have gotten much more extensive in what we're writing. We're trying to write how long the symptoms have been experienced, what symptoms they are experiencing, what makes it better, what makes it worse, the context in which they experience the illness, things such as that. As much information as you can gather, because these are all questions the doctor is going to have to ask if you aren't able to complete a really thorough history of present illness. So this is what the doctor is going to want to read when they first see the patient. Okay, so review of systems. Review of systems is similar to it's very similar to the chief complaint and the history of present illness, in the sense that you're going to document all of the symptoms that the patient is complaining of here. But not only are you going to document the things that they told you about in the chief complaint and in the history of present illness, but you're also going to document any other things that they're experiencing. So if a patient comes in and they're there to see a doctor for stomach pain, but they also said, they've also had some ankle soreness from a sprain they had a year ago. You're going to want to document all that in the review of systems. But the ankle sprain, you wouldn't mention that in the history of present illness. That doesn't have to do with the chief complaint, the main reason why they're there. Those are things that get documented in the review of systems. So you just scroll through the review of systems. You don't need to write a paragraph for this. You scroll through, you tap each symptom once, and that selects no. So if you ask them, or if the doctor asks them, like, have you had chills, fatigue, fever? So all the negative ones, the symptoms they claim they don't have, you're not going to go through this entire list and ask a patient if they've had these symptoms or not. There's a very extensive list. When the patient is going and they have their physical exam and the doctor asks a lot of questions, like, have you had a fever, have you had weight change, have you had hearing changes, that's when you're going to document all of these things. So then you'll want to document the chief complaint and any other complaints that they have here, but then you're going to keep adding to the review of systems as they do the physical exam and the patient confirms or denies certain symptoms that the provider will directly ask. Make sure you are documenting that stuff, because negative findings are just as important as positive findings. And then to positively select a symptom, you're going to want to double tap the symptom. Okay, you're also taking the past medical history, past surgical history. Both of these are taken in the triaging process. So past medical history, be extra sure that you take the current medication that they're on. That's going to be one of the main things the doctor is going to want to know, besides their chief complaint, is what are they taking now. And some of this will pull up when you take information from the previous note, because you've essentially created a note that imported some of this information. So there might already be something written there. Make sure you ask the patient, you update their past medical history, because they might have changed the medications that they're taking. They might no longer be taking those medications. Not all of our patients come every month, so their situations change. For the purposes of our clinic and in the interest of time, we're not going to have you take family history. However, if a provider starts asking about family history because it is relevant to their overall diagnosis and course of treatment, then you want to add that information here. So you're not going to, during the triaging process, you will not ask them about family history, but you can add information to it if it is somehow obtained during the physical exam. Note here also, OBGYN, we actually are going to take some of this information, and we'll talk about that in a little bit. So, what we want you taking in the OBGYN section, this only applies to females. LMP. LMP stands for last menstrual period, so you're going to write the date of their last menstrual period. We don't want you asking patients if they've gone through menopause, and we don't want you asking them GPA. GPA stands for the number of pregnancies, and then the P is the number of live births, and then A is the number of abortions. That kind of information is going to be obtained on another trip when we have our Women's Health Day, and it will be obtained by trained professionals. So for now, please don't ask our patients that information. Periods, you actually do need to ask this part, though. The only two things we want you to be concerned with are, was a period normal? Was it on time? If it was abnormal, then you just write abnormal. If it was late, write late. If it was early, write early. If it's inconsistent, write that. But that's the general information that the provider is going to be looking for when they look at the OBGYN information. And again, that's only for females. Social history, for the purposes of our clinic, we are also going to refrain from taking social history. However, again, like family history, if the provider asks certain questions, like about tobacco or alcohol use, things like that, or if you happen to know that one of the patients likes playing soccer a lot, you can add that information into this section. Just don't spend time during the triaging process doing it. Only do it if you should come across the information during the physical exam or otherwise. So the data section is where you're going to record things like lab results, if we get like a stool sample or a urine sample, ultrasound results. We do actually have an ultrasound at our clinic, things like that that you can't necessarily find when you scroll through the physical exam section. And it would be any other notes that you couldn't find in the physical exam section either, and we'll talk about that in a minute. Also, we understand this app is really new for you guys, and most of you have probably never had to deal with EMR before. So in the interest of time, if you feel like you aren't able to scroll through the review of systems and the physical exam and catch everything the doctor is calling out as part of their assessment, then you can go ahead and take notes in the data section, and then you can input the data later in the physical exam and the review of systems. The main thing is we don't want you to forget or to lose information or to miss information looking for things in the app. So treat the data section as sort of your note-taking section while the provider is treating the patient, as well as an actual official record for the things like the lab results and tests and such. Okay, so here's the physical exam section. You can see there's each of the systems. The systems that are in the red box are the ones that we're primarily concerned with. We don't hand out psychiatric meds at our clinic, but for the physical exam, you notice it's broken into different body systems, essentially. And so if a doctor is looking at somebody's eyes and they call it that everything's normal, then you'll go into HEENT and you'll put that information there. So you would select the body system, and then you can put whatever details the provider's called out. Our providers are trained to call things out to you so that you know that you need to include it in the chart notes, that they think it's important. So then you'll go ahead and type whatever it is, and then you hit save and then back, and that takes you back to the previous screen, and that takes you back to the remaining systems. So the assessment section here is the diagnosis. It's deceptive because it's a really large box, but essentially it's just going to be maybe a sentence max where the provider states what they believe is the cause of illness, the diagnosis. So for our example patient, it's allergic rhinitis, and that's all we're going to put. The plan, however, you're going to put more. So you're going to want to put the prescriptions the provider assigns. You're going to want to put, the follow-up time, and the things that the patient needs to seek extra help for if they should experience these symptoms. And at the end, we're going to have the provider review your notes, of course, to make sure you've spelled all the prescriptions right, that you've put the correct dosage, and the correct frequency and all of that. Also note that the plan section is used for the English and the Spanish triage signature, so we want you guys to write your names in there, both of you, so that if there's any questions about the chart note, or if the doctor forgets something and we need to go back, or if maybe you forgot to fill out a section, we can come back and ask you questions if we need to, just to clarify the charts. So, you have officially finished your first chart. So then at the upper right hand corner, you're going to tap the done button. And then if you scroll down to your completed chart, this is what it looks like. And it says full note. And it's the provider's job every single time to read through this and make sure everything that they wanted in the review of systems or the assessment, all that is spelled right, is complete, that the dosages are right. We want them to double check your work to make sure that you got everything in there that they think is important and will be relevant for the next provider who looks at these. So then they're going to hit sign up in the upper right hand corner after they've reviewed your chart notes, and they are going to put in the password. You guys will be given the password, as will the provider, and as soon as they put in the password and select OK, that's going to complete the chart, and it will appear as signed in the upper right hand corner. Okay, so one thing we want to talk about is syncing the iPad. So please don't shut the app down while you're at the clinic. Go ahead and leave it open. When we get back to the States and we get back on Wi-Fi, then us board members will sync the iPad once we're on the internet, and it will go to a larger database. And the thing I really wanted to impress upon you is that we don't have Wi-Fi at the clinic, so we can't sync the database until we return to the US. So once you triage a patient, that same iPad must follow that patient until the end of their visit at our clinic, because we can't sync the iPad, you wouldn't be able to access any of the triage information that you just put in on any of the other iPads while you're there. So, one iPad, one patient, and it follows them throughout the duration of their visit. And that's it. If you can, check out an iPad, practice with the app. After about 10 to 15 minutes, it gets a lot easier to use, and good luck.